Welcome to day 22 of Epilepsy Awareness Month from Sign ESIC. A 5-year-old female child, first by birth order, born out of a non-consanguineous marriage, presented to the pediatrics department with high-grade fever, headache and generalized tonic-clonic type of convulsions from the past 3 days. On inspection, it was found that there was a reddish stain on the right side of the forehead that involved the eyes, half of the nose, and cheek along the distribution of the ophthalmic division of the trigeminal nerve. MRI of the brain showed subtle T2 fluid attenuated inversion recovery hyperintensity in the right occipitoparietal region, and computed tomography scan of the brain showed reduction in the volume of brain tissue and calcified areas in the white matter on both sides of the hemispheres. The electroencephalogram performed during sleep showed abnormal patterns, and the clinical evaluation and imaging modalities confirmed the diagnosis of Sturge-Weber syndrome. Now today, let's understand what this Sturge-Weber syndrome is. Sturge-Weber syndrome is a rare congenital neurocutaneous disorder, and it has an incidence of 1 case per 50,000 population. Although the etiology is not known, but according to a previous study, it showed that a activating mutation in the GNAC gene is responsible for this SWS. It is not hereditary, it is sporadic in nature. It is characterized by leptomeningeal angiomatosis and port-wine stain of the face in the region of the ophthalmic division of trigeminal nerve. The symptoms include seizures, recurrent headaches, stroke-like episodes, hemiparesis, psychomotor retardation, and mental retardation. Cognitive impairment, visual defects, etc. can be seen. And in 90% of patients with SWS, the first manifestation is seizures, focal or generalized, which occurs in the first year of life. The radiological imaging with the findings of leptomeningeal vascular malformation on contrast enhanced T1 weighted magnetic resonance imaging and cortical and subcortical calcification on head computed tomography is the basis of diagnosis. On CT, it detects calcification, with the gyriform calcification being the most common feature, and it is described as a tram track sign. The treatment modality is generally supportive and symptomatic using AED aspiration. And surgical procedures include hemispherectomy, corpus callosectomy, vagal nerve stimulation, focal dissection of seizure focus. It is contraindicated in patients with bilateral involvement. This is reserved for people only when medical therapy is not effective, and it is also done in patients having glaucoma. It is a rare sporadic genetic syndrome which lacks a definitive treatment. So I hope this video helps, and thank you.